So during the pandemic, there has been certain groups that have been affected disproportionately with severe disease, and the vulnerable population group is quite a diverse group of individuals.
Vulnerable groups are always prioritized for vaccination because they're either at higher risk of developing severe COVID-19 if they get infected. The vulnerable groups would include the elderly, patients who are in long-term care, patients who are immune compromised, who are either transplant patients or cancer patients, or patients who are taking immune compromising medications, people who have chronic diseases like obesity, diabetes, renal diseases, cardiovascular diseases, and also people who are pregnant.
Unfortunately, we see patients who are already immunocompromised due to being on medications like biologics, and nobody had told them that they should be vaccinated ahead of time. This is no different with COVID-19. We really miss these patients often, letting them know what their risk is and why it's so important for them to be vaccinated. These patients are as much at risk as our elderly patients. The patients we normally would consider over 65s or even our over 80s are very elderly patients. Our immunocompromised patients sometimes fall through the cracks.
When we talk about, again, cancer as a spectrum, there are certain populations of cancer patients that are at much higher risk. So patients who have hematologic malignancies, blood cancers, usually they're on treatment regimens that are much more immune suppressive. So for those patients, we're focusing on the caregivers, the loved ones, the family members who are around that patient, to provide a layer of protection.
As pharmacists, we can easily run reports on our patient base to see who are our immunocompromised patients, who are our at-risk patients, and have we had the conversation with them about vaccination, including COVID-19 vaccines.
Most oncology patients do have, an underlying level of immune compromise. They are at risk for severe complications from COVID. That risk is definitely less with vaccines on board. So as soon as the booster is available, as soon as that patient is eligible, we do recommend that they get it. Again, sometimes we need to time it in terms of where they're at, in terms of their chemotherapy cycle. But for most patients, we say, if it's available, please go and get vaccinated.
For high-risk groups or those who are vulnerable, the recommendations for vaccination have been now pretty consistent that they should have up-to-date vaccinations.